Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I'm Dr. Raviouf Asimi. I am professor and head of the Department of Neurology at Sri Kashmir Institute of Medical Sciences, Srinagar.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah, uh, Basically, the brain uses the tiny electrical signals to control everything we do, we think, we feel, and whatever we do. So, a seizure happens when a person's brain is overloaded by these abnormal signals, not normal signals, but abnormal signals. The amount of this abnormal electrical activity will define the type of seizures a patient gets. Some doctors also describe a seizure as a storm in the brain. Uh, During a seizure, a person might lose consciousness. He might shake or convulse, uh, or there might be abnormal movements of a part of body, uh, or there can be sudden fear, or there can be like in psychosomatic seizures, there can be panic also. So these are the basic things what happen during seizures.
What is epilepsy?
uh, Epilepsy is basically if a person gets recurrent seizures. Like if a person gets a single seizure, we don't define it as an epilepsy. If you get two or more seizures, then a patient is diagnosed as having epilepsy, more than two unprovoked seizures. So, if someone has had at least two unprovoked seizures, meaning that the seizures were not due to fever or some infections or some metabolic reason, like a patient of diabetes gets low blood sugar, hypoglycemia, or a very high blood sugar, hyperglycemia, and it gets a seizure. That's not epilepsy. They should get unprovoked seizures, and if they happen more than twice, this is defined as epilepsy. So, epilepsy can include many different types of seizures. Like we have different types of seizures, focal seizures or generalized seizures. So depending upon what type of seizures, we define the epilepsy accordingly.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, not definitely. If you see around 50% of the seizures or even epilepsies, we don't know the cause. And it's only in around 50% of the cases we have a known cause. Like if a patient gets a trauma, suppose he develops a road traffic accident, and after that he has a scarring in the brain, so he can get seizures. Sometimes patient gets infection in the brain, like abscess, brain abscess, or a tumor in the brain. So if they also can cause seizures. Similarly, there are a lot of metabolic factors, like if a sodium in the body goes down, hyponatremia, or if you have hypoglycemia, or you have calcium abnormalities, a hypo or hypercalcemia, meaning thereby if low calcium or more calcium in the body. If we have all these metabolic parameters, infections, tumors, trauma, they all can lead to seizures. But around 50% of the patients, we don't have a cause. Now we are working on genetics of the epilepsy. There are a lot of different genes which have been described as responsible for different types of seizures or different types of epileptic syndromes. Work is going on. We are describing newer genes every now and then. So hopefully we might find out more and more causes with more as the science advances, we might find out more and more causes of epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, basically we have to describe the seizure. Epilepsy, as I told you, is a syndrome wherein there is recurrent seizures. So these signs and symptoms, it depends what type of epilepsy a patient has. Like we broadly define seizures into generalized seizures and focal seizures. So generalized seizures are if a patient develops abnormal body movements like shaking of whole body. There can be deviation of angle of mouth. There can be frothing at mouth. uh, Patient can have incontinence of urine or feces, double incontinence, or there can be tongue bite. This is usually seen in generalized seizures. Focal seizures are where a portion part of brain is involved. So patient can get, if it's involving a motor area, patient can get focal shaking of a limb, or there can be abnormal strange sensory abnormal sensations in one part of the body, like upper limb, lower limb, anywhere. But then there are other types of seizures wherein where we say we define them as complex partial seizures, where patient can have sudden stare. They will just look strangely at once they are sitting. They will look. They will have a stare, which is once they don't respond, they are unresponsive during that stare, and they have some automatisms like they pick up their clothes. If somebody asks them questions, the patient does not respond that time. He loses conscious contact with the environment. It lasts for a few seconds. They can have aura preceding these symptoms, and after once a patient regains consciousness, there's a sort of confusion after this. So these are called complex partial seizures. So we can have generalized seizures, focal seizures, or complex seizures, which we diagnose only depending upon the history, what patient says. So depending upon the semiology. So why we advise usually the attendants that once a patient of seizure comes, we ask attendants to take a video of a patient so that we can see firsthand what's the type of seizures they are getting. Are they getting seizures, or sometimes you can have pseudo seizures, like you have psychiatric disorders wherein patient mimics seizures, which are not actual seizures. So that's why this seizure semiology is very important. We ask the detailed history, and sometimes ask the patient to take videos. So for a common person, if a patient has abnormal body movements or abnormal behavior or abnormal sensations in particular part of body, they should usually come for a consultation to rule out seizure.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
This is a very good question. Actually, very unfortunate, and this is the most common problem, the stigma. Because see, people were not knowing that epilepsy is a neurological disorder. That's the point where problems started. They used to say that this person is possessed by supernatural powers, or they have some. I mean, वो जैसे हम अपनी लैंग्वेज में भूत प्रेत का साया है. That's why the attendants used to go away from these people. They don't even the employers did not want to take risk that if we employ these people, they might get fit at the workplace, and they used to avoid them, giving them the employment. The caregivers used to be scared of treating such patients that we might get this disease while they have seizures. That's why there was a stigma. But with the education and with the modern science, and it's not only once a patient of seizure comes to doctor, we don't only treat them, we usually educate the attendants also. We educate them about the nature of this disease, the cause of this disease, and we usually tell them that this disease is not communicable. So if a caregiver takes care of a seizure patient, you should not be scared, or they should be involved actively in some jobs. Actually, it needs a lot of education at community level, lot of education at school level, the uh, education of caregivers, so that these patients are not ignored.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, again, a very important thing. There are a lot of triggers in these patients. Besides taking the medications, we usually advise patients to avoid certain triggers. Like one of the trigger is sleep deprivation. These people should take have a regular sleep, 6 to 8 hours of sleep. They should avoid sleep deprivations. They should avoid stress. That's the most important thing, is avoid stress. Third thing is they should take regular meals. They should avoid this fasting, prolonged fasting. So this is also a trigger for provoking seizures. And then hormonal imbalances in female. Sometimes they might get menstrual seizures, or which are called catamenial seizures. Then there are other drugs which can interact with our anti-epileptic drugs, which can trigger seizure. But the most important thing is the once a patient is taking drug, he should not abruptly stop or miss a dose, which can trigger a seizure. So yes, most important thing is the sleep deprivation and fasting. They should avoid these things, and stress, obviously.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah. See, if we do simple things at home, like if a person is working in kitchen, uh, they can use unbreakable kitchenware. They should not use gas stoves. Rather than, it's better that they should use microwaves, wherein they cannot have, because if a patient gets seizure while working in kitchen, like a female is working in kitchen and there's a gas stove going on, she can burn herself. I've seen a lot of patients who get burns on their hands or face while getting a seizure. So avoid directly working on stoves. Use unbreakable kitchenwares, so that if even if they get a seizure, they don't get injured themselves. Then carpeting. You can use soft carpets, because some of these patients can have sudden falls. So if they fall on hard surfaces, they can get head injuries. So if you use soft carpets or even door handles, same is true about washrooms. They can use handles in the washroom so that they can grip some. If they have aura, they can grip something around there so that they don't get the injury. These are the basic things. And then we should avoid driving. They should be told they should not drive. Epileptic patients, basically, their licenses. We don't have a law as of now. Otherwise, their driving licenses should be, I think, cancelled for some time. They should be discouraged to drive. And then they should not be allowed to go in some risky sports like swimming. They should avoid swimming or mountaineering. They can do some, they can have some sports, because usually the seizure affects young people, so they can go for some safer sports. They should avoid the sports wherein there are, suppose a patient gets seizure while swimming, he can drown. And same is true if he goes for hiking in the mountains, and he can fall from heights. So we avoid risky these behaviors. That's what is my advice for these patients.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, let me tell that epilepsy is a treatable condition. By taking regular medicines, avoiding these triggers, and educating the caregiver, we can go a long way to help these patients to live healthier and better life, get married. Even girls also, there's a concern whether these girls should get married. They can get married, have children. There's very less possibility of these seizure patients getting transmitted to their offsprings. As I told you, there are very few genetic types of epilepsies which can transfer. Otherwise, by and large, they can have a normal life. They can work normally in less risky jobs. Like they cannot work in places where there's heavy machinery, or you have a contact with direct machinery, but they can have shops, or they can have safe places of work. They can lead a normal healthy life. And it's treatable. They should consult doctors and they should treat and live a normal life.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.